Namaste, good evening. I'm Shruti Bharadwaj, a proud volunteer at Project Step 1. I welcome you all to yet another fabulous webinar session on Stopping COVID Global Experience Local Action. I welcome our speaker for today evening, that is Professor Yaneer Bar-Yam. Thank you so much for coming here and agreeing to share your experience with us. I'm sure the session is going to be an amazing one. I welcome you, sir. We also have Mr. Sriram with us. He is the one who helped me with all the easy coordination, helped me with the poster, readily accepted with whatever help I seek. Thank you so much for supporting me so much, Mr. Sriram. I welcome you too. Before we start, Project Step 1 needs no introduction now. Project Step 1 is a volunteer-driven, non-profit collective of individuals from the startup community with volunteers and doctors from across India to provide free access to healthcare via telemedicine to the citizens affected by the COVID-19 pandemic. The ongoing COVID-19 pandemic has made humanity face unprecedented crisis, but our doctors and the medical team have proved to be the heroes over the past 180 days. Our Project Step 1 doctors have made great impact on 5 million lives, have done more than 750K teleconsultations, and have also been successful in preventing more than 5 million contacts. Dear doctors, Step 1 and the citizens need just 30 minutes of your every day. Your 30 minutes every day can save thousands of lives. Give a missed call on 080-471-92219 to join the largest doctor volunteer group. About today's webinar, Step 1 has covered on vital topics that has helped us in the mission of telemedicine and also helped the doctors on this platform to upgrade to any new developments, learnings in the clinics and hospitals with respect to COVID-19 and other health awareness. We have focused on the need of the citizens to be upgraded on the do's and don'ts during the pandemic and keeping in mind to raise awareness. This webinar is an overview of the entire series. I hand it over to Mr. Sriram now for a quick introduction about today's session and the expert on the panel. Over to you, Mr. Sriram.
Thanks, Shruti. COVID-19 took us all by surprise. And regardless of how long this pandemic actually lasts, I think we can agree that we're going to be thinking about this period in history for many years to come. Fortunately, we have had some scientists thinking about precisely such a topic for 3 to 4 decades now. It's a field called complex systems, and it's a field whose time has come. You see, the world we live in has been plagued by a strange philosophical disease for a few centuries. It is a disease of thinking in discrete categories and the inability to integrate them effectively. It's our collective inability to understand how different parts of a system interact with each other. A complex system, on the other hand, is one that is made up of many components that may interact with each other. Examples include Earth's climate, organisms, the human brain, communication systems, or in our current times, the medical, social, and economic response to a global pandemic. One of the leading founding fathers of this critical field is Dr. Yaneer Bar-Yam. He's an MIT-trained complexity scientist and president of New England Complex Systems Institute. But what makes him special is his dedication to help resolve pandemics and his commitment to COVID-19 containment. For close to 30 years, Yaneer has been studying pandemics, and in 2014, when Africa was dealing with Ebola, he devised a community response protocol that actually worked. In January of this year, he was one of the earliest voices to warn the world about what we were about to face. He then went ahead to found endcoronavirus.org, which today is the world's largest volunteer initiative of thousands of scientists, doctors, engineers, volunteers who have come together to raise awareness and laid down guidelines for the right measures across the world. And Coronavirus even ran a newsletter for district collectors across India during April, May of this year. He's currently an advisor to many medical associations and governments in the Americas and Europe. He brings insights from across the world and from edges of what we know as a race. Please join me in welcoming him.
Thank you, Sriram. Thank you, Shruti. Let me express my appreciation for what everyone is really doing today in combating this outbreak. We're facing a very big challenge, and the challenge is affecting us individually. It's affecting us as families, as communities, and as nations, and surely the world as a whole. I want to spend some time talking about specifically medical aspects of the response. and then to give a little bit, broader picture, or maybe I will switch them. We'll see. I think it is really super important to understand one of the things that Ram mentioned, which is that we are being affected and we are responding across all of the systems that are part of society. And the success that we have will depend upon how we do that. We know that it is possible to be successful. There are countries that are living normal lives and are surprised that other places are continuing to combat the disease. And of course, there are countries that are struggling mightily. And we need to understand how to be effective at responding to this disease strategically, tactically, individually, community-wise, and so on. And one of the key principles that we've learned over years, both from the underlying mathematics of complex systems, is to think in scale. And I was going to say, and also from the experience. Thinking in scale means that we have to think about what individuals do, what families, what communities do, and so on. And in the context of the medical aspect of the response, the ability to bridge between what the society has created as a medical environment, which is the hospital, the doctor's office, and the community is critical. Because outbreaks, pandemics happen in the community. And the community response to the outbreak is the most important part of our ability to control the outbreak. Individuals and members of a community, if they decide and if they know how to respond to an outbreak, they can stop it. And that means that it really should be understood as a responsibility of the community, that everybody else, the medical system, the government, other institutions, must work to support the community effort in addressing the outbreak. And for this, maybe it's helpful if I talk about a story about what happened with Ebola in 2014. The traditional way to fight outbreaks is when someone is sick, they come to the hospital, they report that they have symptoms, to treat them, but also to ask them, who did you touch? And in the context of finding out who they touched, to go back into the community and to identify cases and to isolate them. Contact tracing, which we all know. But for Ebola, in a city, in a major metropolitan center, it doesn't work if you have more than a few tens of cases to do that. And it's clear why. It's hard to find all of the cases. So in 2014, I recommended that we think at the community level and go into the community and identify cases early and stop the outbreak by identifying them early. And the epidemiologists that I knew and the simulators, the scientists, all told me, no, there are going to be 10 million dead in West Africa. There's nothing you can do. And And yet I tried to get the government in the US, I was advising the government at the highest level, National Security Council, the people who were involved in the outbreak response, the CDC, and the UN, the head of the outbreak response. But it wasn't happening. A friend of mine gave me the phone number of physicians in a medical group in Liberia. And they put me in touch with the people who were involved in the response. And in the beginning of October, the second week of October of 2014, I said to them, well, how are things going? What's going on? And they told me about what they were doing generally. And I said, well, what about doing this? And they said, oh, yeah, we started doing that 3 weeks ago. And the outbreak went up like this and went down like that and went away. And there were 10,000 people dead. Now, 10,000 people was a lot of people. It was over 10 times as many people as ever been killed before in an outbreak of Ebola. But it wasn't 10 million people, just 1/10 of 1%. So what happened? I wasn't responsible for it. It was the communities themselves that set up teams that went door to door. And in going door to door, they identified cases earlier and were able to stop the outbreak. So the key again was the community taking ownership and responsibility for stopping the outbreak. And the information about what's going on with the disease and what actions to take they could be informed by it. But empowering them and having them understand that they have the ability to stop the outbreak is super important. And recently I spoke with a diplomat and a physician. They wrote a book called Getting to Zero. They were on the ground in Sierra Leone, and they learned the same lesson. And the physician first name is Oliver, who did the work there, is now in South Africa, and they're being successful in really addressing the outbreak. And again, the main responsibility, he said, is that we have to have the physicians reach to the community and have the community be the nexus, the location where action is taking place. And this is super important for people who are working to provide telemedicine, to recognize that it's not just the individual advice we give people about what to do in the context of an outbreak, taking care of themselves, maybe taking care of their families, but to encourage them to recognize their power to stop the outbreak through community action. To get together with neighbors, with others in their community, and work together towards stopping the outbreak. And having a real goal of stopping transmission makes a huge difference. In Italy, there was a village that decided in the middle of the outbreak, the first spike of terrible cases in Italy, they decided that they would get rid of the outbreak, and they did in their village. So recognizing the power of the community is central. And in order to do that, we have to then help them understand the mechanisms by which they can take action and provide them with the support that will enable them to have the right information and the right care and infrastructure that will enable them to be successful. People have the answer, and really correctly, the question is in the community. And when I worked after West Africa, after Liberia, when I worked in the Congo, I eventually created a community organization myself. And the reason I did is that the other humanitarian organizations were asking me, well, how do we get them to do what we tell them? And I said to them, well, did you ask? And really the key here was to recognize that without inquiry, without finding out, it's like, when a patient comes to your office, when you talk to them in telemedicine, the first thing you do is you ask, what's going on? Well, that has to be done for the community too. If we think of the community as being the one that is sick, it's a helpful thought. Then the first process is to inquire. What's happening? What help do you need? And that help includes medical help. It may include food. It may include logistical support. It may include all kinds of things. But it's always essential to ask the question. And so if the questions that you're asking in telemedicine are just about the individual, I recommend expanding them. And if your questions that you're asking about individuals in the community, it's important to interact with the individuals. It's important to interact with natural leaders. The natural leaders in the community are not always the ones that have positions of nominal power. They're the people who talk to other people, who know other people, who are networked into the community, who are connected, and can galvanize the community and are trusted, most importantly, are trusted by the members of the community. And they're the ones who can build a team and change what's happening in the community. And it's best to listen to what they think are needed, because they probably know better than we do. So that's super important. Now, we can also talk about specific medical support that has to be done. So let's go through the key aspects that we've identified and are clearly playing a role everywhere that outbreak control is being successful. And let me just say that everywhere in the world, there are unique challenges. There are very, very difficult challenges. Some of them have to do with high density slums, very difficult conditions where people are living, where they're vulnerable, marginal populations, as they're called, people who are in trouble anyway and are faced to this tremendous challenge. It's super hard. That's one. Another is communication issues. A third is conflict between groups that are fighting each other. And the first thing, of course, that happens is that when anything happens is that the groups are attacking each other. Another area is people somehow jump to the conclusion that economic matters more than health. Maybe that's because they think that way normally, but in an outbreak, economics and health go together. And so businesses and business leaders should be working very hard to get rid of the disease, because without getting rid of the disease, economics doesn't work. And so these are structural problems, really structural problems in the society. And when we have an outbreak, we have to face not just the pandemic, but also all of the structural problems in the society. And recognizing that these are issues really involves us in addressing those problems as well. We can't bypass it. So we have to have people who can talk to all of these issues and can build strategies that understand them. And again, those strategies are local and have to be thought about in a local and regional, state, and national context.
Professor,
Yeah.
there's a certain question that I assume some of the doctors might actually have here. Uh, what is your advice to the doctors here on what kind of advice they could be giving their patients uh, on how dose response works? How especially the dose of inoculation, like the first time you have contact with the virus, how do you take the edge off, and what kind of behaviors would promote
Yeah. Well,
safety?
let me go through systematically. The first strategy that everyone should be involved in is getting everyone involved in stopping the outbreak. Everybody has to participate in that. And having the people that you talk to be involved in that is super important. The second thing is prevention. And Shriram is asking a question about how do we prevent? How do we prevent transmission? How do we prevent cases from being severe? And the answer, first of all, is we don't want to get sick. And so we want to make sure that we stay away from other people as much as possible. And so we don't want to be breathing the same air, because breathing air, of course, is how the disease is transmitted primarily. And we don't want to touch surfaces in common. And mask wearing is critical. Now, what Shriram is referring to is if we reduce the exposure, maybe the cases will be less severe. And there is now developing theory about this, but the main thing is that there are a lot of factors that influence the severity of cases. But we surely want people to be exposed as little as possible to the disease. And we also want people to breathe fresh air as much as possible, because breathing their own viral particles or the viral particles coming from someone else is going to be affecting their health. So prevention of transmission, prevention of exposure is the second thing. The third thing that doctors should be taking care of course, is when people do get sick. What do people who are sick do? And again, part of that is to make sure that they take care of their basic health. Their basic health in terms of the usual things that you do with a cold: drinking a lot, eating good food, sleeping well, breathing fresh air, again, super important. And then how do we know if they're sick? Testing, contact tracing, isolation of people, and that includes setting up isolation facilities. And whether the community does that or the government does that, it's really important to isolate people away from the families, away from their housemates, so that more transmission doesn't take place. And one of the specifics that doctors can do is to improve the testing and to know and understand what testing works well for and what it doesn't work well for. And testing, the standard PCR testing, has a 30% false negative rate. There are a lot of false negatives. And very often it takes a while, depending upon availability. There are now quick tests. Results, if they come back fast, are much more useful than if they come back slowly, of course. But if they're false negative and we're telling a lot of people that they don't have it, that's not a good thing. So there is a better test that has been used since the beginning of the outbreak in China. It has been used in South Korea. It's now being used in France extensively, and in Egypt as a primary testing, initial testing. And that's CT scans. So CT scans, imaging of the lungs, These are not contrast CTs, these are non-contrast low-dose CT. So they're not super expensive. They're about the same cost typically as a regular PCR test. And they can be used effectively if they can be, if the logistics of bringing someone to a CT equipment or having mobile CT units travel to communities, which is a logistical issue. But again, if the logistical issues can be addressed, they can be used very effectively. And it's important to advocate on their behalf because they will help to stop the outbreak. We've done calculations of their impact on the R value on the epidemiological transmission, and it's significant impact on the outbreak. It can really slow the outbreak, and that's super important. So that's the testing side. And then the fourth thing, to encourage communities, whether voluntarily or through community action, individual action, community action, or government action, is to limit travel between communities. If the community is sick, it shouldn't be getting other communities sick. And just like we want to stop transmission from one individual to another, we want to stop transmission from community to community. It's a super important way of thinking about the disease. And if we stop it transmitting from community to community in communities where we're successful at getting rid of the outbreak, those that heal, they can continue to be healthy, they can go back to normal, they can restore economic, social activity, and the focus of attention of all of the efforts can shift to those communities that still have the outbreak. And so gradually, we call this a green zone strategy, gradually to expand the green zones. And in every country in the world, there are areas, no matter how strong the outbreak, there are areas that are already green. And so to anchor their safety by instituting travel limits on travel, which can be voluntary, telling people, hey, we don't want to bring the disease into the community, don't travel over there to other places, other communities, don't have people visit you. It really makes a huge difference in stopping the outbreak. Again, everywhere that stops the outbreak quickly using these methods. And then, of course, whatever is necessary that people are doing, whether the society is shut down in a lockdown. And by the way, lockdown really should mean travel restrictions. The other things are stay at home, social distancing instructions. So with whether people are going to work, regular work, or just going to essential services, we need to work on having safe context wherever people are. Home safety, work safety, improving the safety. And best things are, of course, to do things outdoors, to have delivery, to have drive-by or walk-by pickup outdoors. And if people have to be indoors, of course, wearing masks, and even outdoors wearing masks. Everything that we can do to prevent transmission in the workplace, whether it's an essential workplace or any other workplace. And of course, to protect high-risk institutions, whether it's old age homes, nursing homes, or prisons, or any other place where people live together, have to be very, very precisely protected. And finally, what I haven't yet mentioned is that the medical institutions need to be supported very well. The challenge to provide effective medical care in an outbreak is tremendous. And galvanizing the effort, the resources, whether it's PPEs or equipment, whether it's medical organizations, and again, expanding our understanding of what a medical organization is from the hospital into the community, having people in each community, in every community, whether it's trained medical workers or whether it's community members that become connected to the medical effort and are participating. I mean, think about it, right? We have individuals that have to be informed about what is going on and what steps to take. We need information from them about how they're feeling, and we have to check in with them as frequently as possible. If possible, let's say twice a day, to find out how they're doing so that we can isolate them if they have symptoms. And so we have to check in with them. We have to give them information in the community. Then they have to be taken to be tested, or tests have to be brought to them. That's part of the medical process, usual medical process. And then we have to give them results, and then we have to isolate them, whether in the community or whether in some other isolation facility. Notice how we're going back and forth to the community, back and forth to the community. If we don't have effective communication, effective logistics, effective interactions between people who are medically trained, people who are understanding the outbreak, and the people in the community, it cannot be successful. So I really encourage you to think carefully about how to build organizations that are embedded in the community and not just outside the community, kind of reaching over to it. I think that's enough as an introduction. I'm happy to take questions. All questions are good
Professor,
questions.
what is your current recommendation on travel? One, are travel bans between countries still important? And two, if one must travel, what is the best way to protect yourself when you're during air travel?
Good. So first of all, travel restrictions are an essential part of control. Again, it's like treating the community as being sick and using that idea to guide our actions. If we don't, if when someone is sick, we isolate them, then when a community is sick, we want to isolate them so that we can have healthy, COVID-free communities, green zones. And that should be done at every level, whether it's a neighborhood in an urban area, whether it's a village, whether it's a city as a whole, whether it's a state, province, whatever is the natural category that people are using. And natural boundaries may not always follow political boundaries, so we have to figure out sometimes how to modify them. But thinking in terms of travel restrictions is like, imagine you're in a fight, a wrestling match, and you tie your legs together. It's not going to be very helpful. We have to free up our ability to do different things in different places in order to be successful, and to focus our attention on where the action is needed and protect the areas that are well, so that we can progressively improve. It becomes a ratchet, progressively improving. And if we don't impose restrictions, we just allow ourselves to get worse and worse. So travel restrictions are super important. The second thing is, what do you do in order to protect yourself in travel? So the standard challenges multiply when you're traveling. One of them is because travel often is done with others. Travel in buses and planes, everywhere involves interactions with others. It's best not to. So of course, if you have a car and you stay in your car, and then, going into a hotel is a risk. So if you don't have to go into a car, or you can find a way to stay in your car, or sleep in your car, if there's a way to avoid being in shared spaces, that's the best. And if there are shared spaces, it's really important strategically to influence the safety that's taking place, and to remember that there's always a risk from interactions with others, and to wear masks very, very diligently, to wear goggles or face shields, PPEs, to wear a suit that you can take off when you're in a safe space and you put on when you're not in a safe space. Separate clothes to protect you. And again, the best thing is not to have to travel. And that's why telemedicine is so important, right? Because having people travel creates risk. And especially, of course, to a doctor's office or to a hospital where people who are sick go. So it's very likely, it's more likely even than in the community, that the disease is present in places where people go to get care. And so we really have to be super careful and separate places where they're treating COVID patients from other medical care as much as possible, even setting up separate facilities or hospitals to deal with different needs. Have I answered your question? Any other questions?
Yes, Professor. Yes, Professor. So, Sriram, do you have any question?
Yeah. There's a question that came up. So now that a lot of people are quite isolated, populations are isolated, kids aren't going to school, germs that were otherwise getting transmitted aren't getting transferred between people right now. So is the risk of future pandemics now getting higher? Because now we're getting more and more isolated as countries, as communities. And if that is the case, what does that mean for general level of preparedness in society, and what can we do to manage that risk? Because that could also compound with
I
time.
don't think that that's the same risk as you think. I think we need to isolating. If the biggest risk that we face from pandemics is actually when people are traveling. In fact, the first paper that I wrote about pandemics was an analysis of the effect of travel. And the thing that we learned was that the more travel, long distance travel you have, not only do diseases travel faster, but you end up with having worse diseases, because the diseases that can survive when you have local transportation are not the most severe diseases, because the most severe diseases die out locally and they don't go to other places. But when you have long range transportation, the severe diseases are able to spread. And so you actually have a transition to global extinction, which is what I've been warning about for years. It's very scary. So both limiting some limitation on travel globally may happen as a result of this outbreak, and that will prevent pandemics. And some ability to respond to a new outbreak through the ability to limit travel is essential. And remembering that our ability to respond to diseases is challenged for new diseases, not for the human diseases that we've been living with for hundreds of years, and especially that we've learned how to eliminate many of the worst diseases using vaccinations. So the real challenge is to prevent new diseases, zoonotic diseases, diseases that come from animals, from spreading rapidly around the world. And that's the challenge that we face of pandemics. What other questions are there?
Okay, so there's one question from the audience which says, what advice do you have for countries like India where social distancing is almost a luxury given the population density here?
Yeah. So first of all, it's important to remember that India is incredibly heterogeneous. There's a huge population that's rural and where social distancing should be better possible, though of course poverty communities work together. But again, if they work together to stop the outbreak, then they can be successful. And in high density places, and I know that the big challenge really to stop the outbreak is in the high density places in the urban areas. And there are two different strategies. And it's important to think about and to use where possible both of them. One of them is dedensifying, taking people from high density housing and moving them elsewhere temporary places. Depending upon the weather, depending upon the available resources, depending upon the available facilities, to take people out of the density housing, even if it's not everybody. Maybe it's youth who can be separated from families without much risk, like they would be in a school away from home, taking them to the country, to tents, spreading them out, and reducing the density of the housing. Of course, this has to be done with community trust. But if families can be taken, or neighborhoods can be have density reduced, it tremendously helps to stop the outbreak. So this is one method. It's very direct. There's one thing, by the way, that I want to mention. It's relevant to the travel, it's relevant to high density housing, it's relevant to everything, and that is bathrooms are a key place of transmission. And recognizing that bathrooms are a critical issue is important. And setting up bathrooms that they have better ventilation. We know that the viral particles can stay in the air. Flushing a toilet can make viral particles from feces go into the air. It's super important to have effective ventilation of bathrooms. So airflow is important. HEPA purifiers, where they're available, of course, that's again another expense, but where they can be put, critical locations, bathrooms in hospitals, in facilities where people go who are sick, absolutely important. But now, so I started talking about dedensifying. The second strategy is the strategy that we know, which is super rapid identification of cases, even suspect cases. It's the door-to-door process, going into the community, making sure that everybody is being checked as frequently as possible. And in order to do that, the community itself and the trust of the community and the engagement of the community and empowerment of the community is super important. If people report as soon as that they have symptoms, any symptoms, and remember, it's not just respiratory symptoms, it's gastrointestinal symptoms, all kinds of symptoms. Nowadays, we know anything almost that it's a symptom, can be a symptom of COVID. And so rapidly taking people out of the community if they have any kind of symptoms, whether it's for testing. And remember, 30% false negative, so one test is not enough. If we return 30% of the people who are sick back into the community, there's no way we can stop the outbreak. So every attention has to be made to speed and what organizations can execute on rapid local response. Oh, one more super important. The disease is a super spreader disease. So everywhere it is, it's localized, hyper local. That means that if you have one, right, if there's a case in a family, we want to quarantine the whole family, contact tracing, quarantine the whole family, not just take the person who's infected. And we want to quarantine them from each other because they'll just infect each other if one of them is sick and the others are not. But what tends to happen, and this has been seen many places, is that, let's say in a hospital, if there's infection in the hospital, you find a couple of cases. You have to test everybody because there are a lot of pre-symptomatic individuals, maybe asymptomatic individuals too, that are around. And so they may have caught it, so we have to test everybody. So same thing also in the community. And by the way, you can have one room where everyone is sick and the next room where nobody is sick. It's very localized. So you have to take, if there's a case in a building, you want to test all the people in the room. If you want to, but then you want to test all the people in the building. Everywhere that you have connections between people, you have to test as many people as possible around any case. So again, this is like separating neighborhoods, separating buildings, separating city blocks, separate whatever. We have to treat it area sick. We have to test everybody or as much as possible around any case. And that enables us to overcome the disease.
On that note, Yaneer, one question that's been around in India. A lot of people are being asked to home isolate with their families, of course, even if only one person is positive. And it's unfortunately a reality because hospitals are overflowing and we actually don't have capacity for.
This is where the community matters. We have to recognize that much of the isolation can be managed by the community or near the community. Setting up isolation facilities that are community-based is important. You can then set up separate isolation facilities. We need to convert stadia or whatever it is to isolation facilities. Whatever are the buildings that are available, this is where the government can help a lot. Setting up large facilities for isolation, setting up community-based areas for isolation in the community wherever possible. It's helpful for trust. It's helpful for everything. We need to expand what we think about as being isolation facilities. So you set up facilities that are appropriate for very sick people, hospitals. You set up facilities that are different for mild cases or for moderate cases. You have facilities for different stages of the disease so that the level of care can be mass produced and people can be shifted from one care facility to another if there are problems. We need to treat this as and by the way, organizations that deal with logistics can be brought in to do help. Military, super important for large-scale actions like building facilities. The military has a lot of means and a lot of capability, whether it's field tents, whether it's the ability to convert an existing building to a medical facility that is if people are sick, they can be isolated together. Again, best to have good airflow, but they at least don't have to be separately isolated one for the other. So setting up a stadium where you have lots of beds and the ability to take care of people together, that's a super effective way to deal with the problem of isolation. Does that help?
Yes, definitely.
Yeah.
You wanted to add something, Srinath?
No. Actually, because the rest of the question was if it's anyway happening, any precautions that we can take so that people who are isolating at home ensure that, for instance, one of the ideas that was floating around was try to create a negative pressure. Have a fan that's facing outwards in your room.
Yeah, any ventilation that you can do. But remember, bathrooms. Shared
okay.
bathrooms are places of transmission. To have people isolating at home and not have separate bathrooms is super hard. Again, it's better really to seriously think about whether you can have local facilities. I mean, this is done in the poorest communities in the world. To have local community-run or community-based isolation facilities, and again, maybe what you do is you take the healthy people out, and they're the ones that live with other people rather than the sick person going to live with other people. You have to be creative and find solutions that work locally. Again, we don't want people to be together, and if people can, I don't know what the weather is like. Again, I keep pointing at this. Camping out for a couple of weeks can be done in many places, depending upon whether it's too hot or too rainy or whatever. But we're talking about fighting a disease. We have to be creative. We have to do whatever we can to prevent transmission.
Okay. So adding to this, we've been listening about how important immunity is in order to protect oneself from COVID. So the question is, how do one protect themselves if he or she is immune compromised, and how can other people maximize their immunity?
So if you're immune compromised, we just have to ramp up the isolation. They have to be in isolation. Well, what we're doing really is we're just instead of just isolating the sick, we're isolating everybody. And if someone is immune compromised, we have to treat them as if they're sick and isolate them. It's just all about isolation. And again, in order for people to isolate, they need help. So community has to help and provide what is needed. Again, it could be food, it could be other things, it could be emotional support, it could be psychological support, all kinds of things. We're really isolating everyone because we just want to make sure that the disease doesn't transmit. It's pretty straightforward. And how do you improve your immunity? And the answer is you have to be healthy. So the most important thing is eating well, sleeping well. Good nutrition is super important. Good exercise, fresh air. Being healthy is helping your immune system to fight disease. By the way, one thing that many doctors know is that if someone gets sick and they have a fever, unless the fever is too high, and I have to remember, right, it's in centigrade, I have to look up the numbers, but low-grade fever should not be treated because that's part of your immune system fighting the disease. Only when it gets higher, at least as far as we know, for in general, only when it gets too high do we start giving medicine to bring fever down.
Okay. There's one question on how do you prevent spread of infection from fomites, objects that could carry infection, everyday objects, and do UV rays from the sun decrease viral load, and how effective is fogging in open areas? And I'm aware that UV rays, or at least sunlight, is very useful in producing vitamin D inside the body, and antimicrobial particles or peptides, as they're called. So they have a good effect on people, but how effective is sunlight or UV from sunlight in cleansing surroundings?
Yeah, UV is good. I mean, sunlight in general. And again, airflow is helpful. But the point is that heating things disinfects them. In general, if you raise the temperature, low levels of high temperature, right, which in India sometimes happens outdoors, it can be very hot, is disinfecting. It takes different amounts of time, right? The hotter the temperature, the shorter the time. So at high temperature, like 80 degrees, it takes minutes. But at 40 degrees, it takes, I don't remember how long, we can look up the tables. But hotter temperature and sunlight also helps. And disinfectants help, soap helps, alcohol helps, of course, surfaces. But the most important thing, because we have lots of surfaces around, is where there's shared spaces, like in the entryways and the stairwells and elevators of buildings, in common areas, not to touch surfaces, to use something disposable, piece of paper, piece of plastic, a glove, and to throw it out, right? To dispose of things that you use, disposable items to touch surfaces, and to discard them. So transit through shared spaces and touching of surfaces is to be discouraged. But yes, disinfectant, fogging, sunlight, and so on, everything helps. But to take precautions means to try to do everything, not just one thing. And so as much as possible to limit contact, and as much as possible to use any means to disinfect and to remove the viral load from surfaces.
Got it.
Time, right? It's time. Letting things sit for days tends to disinfect them. Different surfaces, different amount. And we don't have all the information we should, but those are super important methods.
Actually, I have a question for you, Yaneer. What is the there's this concept of hormesis where the body gets stronger with low exposure to stress, acute stress, and it applies to like weightlifting and other domains of human endeavor, not viruses, obviously. But what is your read on, like, could some acute smaller doses build immunity in people with time? Because when there are some zero surveys that have happened in India, especially in Delhi, and the numbers are pretty high. They're like 20-25% of people test positive, and although case numbers are nowhere close to that. So I don't understand why the zero surveys are
So
so
there's
high.
still a lot that we don't know.
Mm.
And eventually at some point maybe you'll learn, and we think that Western medicine knows a lot, but the truth is it knows very little about these kinds of things. The problem is that during a pandemic, we can't wait for things that we don't know, and it's easy to speculate. People come up with all kinds of answers. So the important thing is to figure out how we can test them, how we can know something instead of how we can guess at something. Of course, if we learn something, maybe we can use it. And there's a lot of traditional medicines that have insights that might be helpful. But again, the challenge in an outbreak is time. And unfortunately, we've been in this for 9 months. But my strategy, the emphasis that I'm making is that there's a way that we know that we can get rid of the disease. And it doesn't take all that much time. If we put all of the tools that I've talked about together and we really focus hard on zero, on getting to zero, it's a strategy. If we all say, hey, we're not going to live with this disease, we're going to get rid of it. And we put all of these pieces together. What were they? Having everyone on board, travel restrictions, prevention of transmission, because the disease dies if it doesn't transmit. If we take care of cases and we isolate them, and we do effective rapid isolation, and if we protect essential services and vulnerable institutions, and then if we worry, of course, about the health of individuals and their care in medical institutions and the systems that are giving them information about their care, if we do all of those things, and it doesn't have to be perfect, we can get rid of the disease in a short period of time, even when there are a lot of cases, because it's only what's called logarithmically sensitive to the number of cases. So in places where there are few cases, it can happen in a few weeks. In cases where there are a lot of cases, so maybe it takes 2 months. In a huge number of cases, it takes 2 months. But we can be out of this disease, and mostly out of this disease in weeks, and completely out of this disease in a couple of months. So my recommendation is to focus our attention really, really strongly and have a strategy that we're going to get to zero. And do that in a community, do that in a state, do that in a province, do that in a country, and serve as an example of how to get rid of the disease. And then, if some people are studying and are doing science and are looking at where there are cases and whether they're delayed or whether there are people who are less disease because of different strains of this disease, because of different population properties, between different whatever. There are lots of different reasons. If we pay attention to those things and we're doing research, that can be science. And if we learn something and we can validate it, then we can use it. But I wouldn't rely on it. Just like we can't rely on a vaccine. We don't know if vaccines will be successful. And even if they're successful, they'll help us getting to zero. Locally, where the outbreak is, we can give a few vaccinations. That's how we defeated Ebola in the last few rounds. There were vaccines, but not enough for the whole population. So we used them in particular places where the disease was after we'd already gotten rid of it from most of the areas where the disease was.
Got it.
Next question.
Okay, since it's time, so the last question would be, what is the take-home message that you want to give to all of viewers?
I think people are very tired and very discouraged, many places. It's very hard, but it's worth remembering that the disease isn't tired. But it's also worth remembering that we can defeat it. And the most important thing I would say is that everywhere where people really work hard to get rid of the disease, we can get rid of it. And it doesn't mean that it's going to roll over and say, okay, I'm not going to infect people. But we can be successful. And again, the most important thing to understand in being successful is that so most important thing is that you can do it, and the second is that it's in the community. That the answer is not a medical problem. The answer is not a government problem. The answer is the community. The community can defeat this disease. And if we help the community as doctors, as policymakers, and if we help them by letting them know, first of all, that it's their responsibility, bottom line, that they can be successful, and that we're doing this together, that all of the available means, all of the societal tools, the government, the military, the health system, the private sector, everybody is working hard to get us back to normal. And then, once we get back to normal, zone, green zones, green zones, green zones, we can return to normal. We can do what we want to do that we can't do now. We can get together with family and with friends. We can go to restaurants. We can have sports events. Most important, right? The things that make life a good life are the things that we can do. And to get there is hard. But the effort, the sacrifice, the things that we have to do in order to be successful are all worth it. They're hard to justify if we do them for months and years, but it's much less hard to justify if we can do them for a few weeks, really push hard, and then be able to get back to normal.
Very well said, Professor. With this, we come to the end of today's session, and I think we should definitely do a part two and episode two of the topic that we covered, because I'm sure our viewers have a lot more questions, but due to the time limit, I think we have to. We had asked you for 1 hour's time, so we'll have to stop here. We'll be coming up with episode 2 soon. So thank you so much for taking time out of your busy schedule and doing this session for us, and for answering all those questions with so much patience. Thank you so much, Professor, for joining us.
Thank you very much, and I look forward to any other interactions. And everyone should know that we are not far away now. The world became close transportation-wise, but fortunately, we also became close communication-wise. And if you want to be in touch, if you want to participate with us in building teams and in taking care of things, whether it's locally, in a village, in an urban area, or in the country as a whole with policies, we're available to talk and to figure out how to adapt the general principles that I've spoken about to whatever circumstances you're facing.
So thank you so much. Thank you, Sriram, for joining and supporting me today here. So, dear viewers, stay tuned for tomorrow's session on changing trends in the clinical presentation and treatment of COVID-19 Indian scenario. So, we'll be coming tomorrow as well at 5 p.m. So, stay safe till then, and follow us on Facebook, Twitter, Instagram, and LinkedIn. And for more information on Project Step 1, visit www.projectstep1.org. Thank you all for joining today.
Thank you very much, and be well.